Stephen Fairley is my name. I'm a gastroenterologist, or if you don't understand that, a gut doctor. And I wanted to make a brief, slightly outrageous video to try and draw people's attention to a silent deadly predator in Western society. And I'm talking obviously in my profession about bowel cancer.
I've taken over the audio of this video as we're having trouble with the background sound. So this is a video made on the 17th of the 11th, 17 to demonstrate that colonoscopy is really nothing to be afraid of. We're just getting organised here, putting on gloves, moving the screen back a bit and getting ready to start a colonoscopy. Clearly the message is if you can colonoscope yourself, it's obviously not a terribly difficult or dangerous procedure, and it is a procedure that saves lives from bowel cancer. Bowel cancer is the commonest cause of cancer-related death in non-smoking males in Australia, and the second commonest cause of cancer-related death in women. So here we are, getting ready. Some gloves, some lubricant obviously, and the nurse is just passing me the colonoscope. I'm lying on my left hand side. It's all a little bit awkward as I'm actually not used to this, and for those of you who are wondering, I am strictly heterosexual. This is purely being done in the interest of raising awareness of bowel cancer, and because I hadn't seen I couldn't see any evidence it had been done before on the internet. So we're just starting in the bowel now. This is the rectum, the lower part of the bowel. The image quality is not perfect the way we've recorded it, but it gives you a better feel for what's going on in the room. With the nursing staff and other assistants, I'm being assisted by Leanne on my right, who's just helping to stop the colonoscope falling out onto the floor when I let go of it with my right hand. And now we're moving around the sigmoid colon. It's a little bit, there's quite a lot of folds here, suggesting I might be getting early diverticular disease or pockets forming off the side of the bowel, as you can see in that section of the colon. And we'll move gradually around the bowel to the very end and up into the small intestine. We may speed the video up a bit to stop you getting too bored during the procedure. Now, talking about bowel cancer, your lifetime risk, if you're a male and you live to the average age of about 85, is 1 in 10. And if you're a female, it's about 1 in 14. So it's slightly more common in males. That equates in Australia in 2017 to about 17,000 new cases of bowel cancer. And if you get bowel cancer, your chance of being dead in 5 years from the disease is about 1/3. So about 1/3 of people who contract bowel cancer will die from the disease within 5 years. Usually bowel cancer occurs in people over the age of 50, but that's certainly not an exclusive thing. Bowel cancer can occur in teenagers, people in their 20s or 30s. The youngest case I've seen was a 13-year-old boy. I've seen 18 and 19-year-olds, and I've seen countless people in their 20s and 30s with bowel cancer, and as I say, 1/3 of them died 5 years, although none of the teenagers I've seen have died, thankfully. We're just sucking out a bit of fluid, as you can see on the screen, and moving through. We just moved under the liver. I don't know whether you saw it, but there was a purple area where we're going past. I'll try and let you know where we are. For those of you who don't know the anatomy of the colon, you see the bowel is going round in a bit of a circle. Yeah, that means I've made a loop in the colonoscope, and I was just trying to work out how to take the colonoscope loop out to go around the last main corner in the bowel, called the hepatic flexure, which was slightly uncomfortable, but no particularly big deal. Now, as a busy colonoscopist, I'd see up to 5 cases of bowel cancer a week. It'd be unusual to have a week where I didn't see at least one, and colonoscopy is the best tool for preventing bowel cancer. As I've said, a better way of this, that's the liver actually. There you can see there's a purpley sort of flat area on the left-hand side, at the bottom of the left-hand side, which was going around what we call the hepatic flexure, just under the liver. And as I was trying to say, that lifestyle changes would be the best approach, obviously, to reducing the incidence of bowel cancer. The trouble is getting those lifestyle changes across to people. This is the end of the bowel, or getting them to adhere to the lifestyle changes. It's the end of the bowel, and this is called the terminal ileum. You can see the villi, the little furry things in the terminal ileum. They're there to increase your surface area. Then we've come back into the cecum, where your appendix is, and we're starting to come slowly back out of the bowel now, looking for polyps, which are little lumps on the surface of the bowel, which increase your risk of bowel cancer substantially, because it's felt most bowel cancers arise in small polyps. Now, lifestyle changes, which would be my preferred method of preventing bowel cancer, are just to revert to a healthy diet primarily, which is lots of vegetables and fruits. It's not a typical Western diet, which is very high in animal protein, particularly red meat, and particularly processed red meats such as bacon and salami and things which we all love. So how effective is colonoscopy preventing bowel cancer? Well, nothing's 100%, unfortunately, and we're not terribly good at colonoscopy. We probably leave behind about 1 in 4 of these precancerous lesions called polyps. However, that means we get 3 out of 4 of them, which probably reduces your risk of getting bowel cancer over the next 5 to 10 years by around 75%. There are no good studies looking specifically at this, but that seems to be about the reduction. It's far better than alternative methods such as fecal occult blood testing, although fecal occult blood testing, which is testing your stool or your poo to see if it's got blood in it, is effective in diagnosing polyps and diagnosing bowel cancers. It just misses far more of them than colonoscopy does. Should you have a colonoscopy? If you're 50 or over, you probably should think about it, and if you have any symptoms and you're younger than 50, you should think about it. The government doesn't pay in Australia for screening colonoscopies, which are just colonoscopies done looking for bowel cancer. They'll only pay if you have symptoms such as bleeding, change in bowel habit, abdominal pain, or something along those lines. You'll find that almost all the doctors in the know have colonoscopies every 5 years or so, even if they have to invent their symptoms, to tick all the Medicare boxes and get the procedure covered by Medicare. So we're continuing to come slowly back here through the bowel. This is thankfully a normal looking colon. I don't think you should colonoscope yourself as I've done here, obviously. I think you should leave this to an expert who's going to look more carefully and find more polyps than you will yourself. So we're just coming out of the bowel now, and that's the end. Pretty simple, wasn't it? If you can do it to yourself, I don't think you need to be afraid of an expert doing it to you. And I'll leave you